Morning. I'm always excited when we open up our annual summit. This is actually our 13th annual summit. Translated, when we got started, my daughter was 4 years old, and now she's on her way to high school. She told me that in the next election cycle, she will be voting for president, and I felt incredibly old. But I am really excited about this meeting because there's so much change in the wind. And I think we have some tremendous opportunities, and we'll talk to you about them over the course of the next 2 days to make some real substantial change. And I'll point out just two of the changes that I think that are important that you should think about during the course of this meeting. The first is the demographic shift. The majority of children under the age of 18 are what we used to call minorities. In 5 years, 40% of the US population will be people that we used to call minorities. By the time we get to 2035, we're going to get close on 50% of the population in the country are minority. That has profound implications for healthcare. Linguistically, culturally, clinically, we are going to need to be able to provide care to diverse populations. If you look at the state of Texas, California, New York, Florida, those states have already changed. Change meaning that in California, Texas, New York, 60% of everyone with diabetes is minority. If you look at what we have called health disparities, we cannot have that in the 21st century because it means that the majority of Americans will be subject to shortened life expectancy, higher hospitalization rates, higher cost. And for those who've got the business head, what it means that the customer base that you're serving will be less likely to buy your products and services because the marketplace is changing and the change is that profound. So when we got started here, back 13 years ago, we talked about equity, we talked about fairness, we talked about eliminating health disparities as sort of a social obligation. That's not what this conversation is about. This conversation is about the future of the American workforce. This conversation is about national security. The world has fundamentally and absolutely changed. Now, lots of people are unhappy about the change, to be sure, but that's the reality, and that's the conversation that we want to have with you today. Because I would argue, in order to meet that change, we have to make some very serious investment in our healthcare infrastructure. Because if you look inside those dispersed historic minority population, we even have to find new language for what minority actually means anymore because there is no majority comparator, right? We're all minorities. But if you look at those legacy communities, what you're going to find is lack of infrastructure for healthcare. And so how do we put that in place? The workforce changes, right? I mean, if 50% of the minorities, historic legacy minorities, are not in the healthcare workforce, then who's going to provide that care? So we have really some deep structural conversations to have over the next 2 days. and I'm really excited about having it with you. I want to take a moment to thank Jay Morey and her team at the American Medical Association. They were really partners with us in putting this program together. And obviously, we're always excited working with Congresswoman Kelly's staff in developing the program. And we thank our sponsors. None of this could happen without their support. And finally, we want to thank you for taking time out of your day to come here and join us. But what we want you to do is not think of this as a talking head convention, but really as an opportunity to plan for our future. Because one of the messages, and the final message that I'll leave you with, is that as I walk through Washington, and I go to the Hill briefings, and I go to the think tank meetings, and listen, I look up on the stage, no diversity. I listen to the policies that are being put forward, no recognition that the world has fundamentally changed. You get the feeling that you're sitting right in the middle of 1950. And people think that there's a homogenized America out there that needs to be provided care. And it's your voices that are needed. It is your voices that are needed on the stage to help reshape fundamentally the way in which we think about healthcare for diverse populations in the 21st century. That's what we're building. We're building something for the 21st century. So please think of that as we go through this meeting. And I always encourage you to think about this is not a conversation about moral rectitude and equity and all of that. This is a different America that we're talking about. So with that, I'd like to, she needs no introduction, really. She's been a partner and friend, Congresswoman Ramanathan Kelly.
Thank you and good morning. It's great to be here with my friend, Dr. Gary Puckrein, to welcome you all to the Summit on Health Disparities and Spring Health Brain Trust. We have a wonderful program planned for you that really gets at the heart of this year's theme, building sustainable communities, delivering quality health care. As chair of the Congressional Black Caucus Health Brain Trust, I'm committed to doing just that, helping to build sustainable communities by strengthening our public health infrastructure and developing community-oriented approaches to public health. To achieve this, I'm working with my colleagues in Congress to further expand access to health care and to spur the medical investment necessary to reduce health disparities and make our communities healthier. And all of you are a big part of that. Over the next 2 days, I am really looking forward to engaging with you and hearing your ideas on how Congress can best address health disparities in America. Together, I know we can make great strides in improving health outcomes for all Americans. Thank you for coming, and I look forward to continuing the conversation with you. It is my pleasure and honor right now to introduce Dr. Patrice A. Harris. Dr. Patrice A. Harris, MD, MA, who has diverse experience as a private practicing physician, public health administrator, patient advocate, and medical society lobbyist, was elected to the American Medical Association Board of Trustees in June 2011. A governing theme in Dr. Harris's professional life has been a passion to improve the lives of children, starting with medical school in West Virginia, followed by psychiatry residency and child psychiatry fellowship at Emory, and then as a senior policy fellow for the Emory University School of Law. She has worked for children clinically and in the advocacy arena. At Emory, she addressed public policy for abused and neglected children before the Georgia legislature and in public education programs. A past director of health services for Fulton County, Georgia, which includes Atlanta, where she directed all county health services for a wide variety of public safety, behavioral health, and primary care treatment and prevention services. Dr. Harris also serves as medical director for the Fulton County Department of Behavioral and Developmental Disabilities. Currently, Dr. Harris continues in private practice and consults with both public and private organizations on health service delivery and emerging trends in practice and health policy. Ooh, you do a lot. Without further ado, Dr. Harris.
Well, good morning, and thank you for that kind introduction. And Gary, thank you for your remarks as well. Very inspirational to get us started. On behalf of the American Medical Association and myself, let me just say that it is an honor and a privilege to be here with you today. The AMA has been a long-time partner with NMQF. And also, I was telling the Congresswoman that the AMA and on behalf of myself have maintained a long interest in the CBC's work in health. Because truly, as we look at health and prevention and wellness and healthcare delivery, it's an all-in proposition, and all stakeholders have to be involved. And I have to say, as you heard, I am a psychiatrist, and truly we need to make sure that those with mental disorders, which include substance use disorders, are included in the conversation. You'll hear more from me on that throughout the conference, and I'd love to chat with any of you about that in particular. This is a transformational time in health. You know, words matter and clarity counts. I said that a lot during my time at Fulton County, but let's take a pause on the word transformational. It is truly a transformational time. It is often a once-in-a-generation's time to be able to be on the ground floor of transportation. Those of us in this room, clearly, by your participation in this conference, are committed to being involved in this transportation, and that is good news. We must be on the ground floor to decide what happens in the future, because as Gary said, we use the words health equity, health disparities, but it's bigger than that. It's bigger than that. Health is bigger than that. It's bigger than a box. We need healthy communities to make sure we have national security, make sure we have good jobs, make sure we have economic security. And so it really is time to expand that conversation. And I know that I and the AMA truly are proud and privileged to be a part of the conversations that Gary talked about. Now, Gary, you also talked about we have to do more than talk. And so it's about commitment. And it's about commitment, and then it's about action. And so I would say, though, that those of us in this room at this conference have already demonstrated commitment, and we will leave this conference with actionable items so that we can move forward and make sure that we have eliminated health disparities. There is health equity. And we do have sustainable, healthy communities, which means we have a sustainable, healthy country. So again, I look forward to working with you during the rest of the conference. AMA, we are very proud to be a long-term partner, and let's get to work.
Good morning. Buenos dias. Any other ways to say good morning in other languages? Welcome. Shout it out. Other languages? Bonjour. Back in my hometown, Barrio, Tucson, Arizona, this is the way we said good morning. So look to your neighbor and say good morning. I know I'm moving into the 40, 50 age range when I have to move back and forth between glasses here, so aging myself a little bit. But it's certainly a pleasure to be here this morning. The beauty of all of the languages that you just heard by this good morning is what this next individual represents. This person is about action, certainly commitment and passion, a champion for equity of care and eliminating health disparity. Has been an ambassador in this work throughout his career and his life. And it's my privilege and honor to be able to share some words about this amazing humanitarian. But I wanted to thank the National Minority Equality Forum for giving the American Hospital Association and its Institute for Diversity the honor and privilege of presenting the Booker T. Washington Award to a humanitarian, Dr. Ramanathan Raju, affectionately known by his colleagues as Ram. And during his 30 years in healthcare, Dr. Raju served in various leadership positions in nonprofit and public health systems, an experienced vascular and trauma surgeon former CEO of Chicago's Cook County Health and Hospital System. Dr. Raju was appointed HHC's president and CEO by Mayor Bill de Blasio in March of 2014. Before running the Chicago Public Health System, he served as HCC's Chief Medical Officer, Corporate Chief Operating Officer, and Executive Vice President, and as Chief Operating Officer and Medical Director for the HCC's Coney Island Hospital in Brooklyn. Dr. Raju did not go unnoticed for his innovative and purpose-driven work over the years. He was named one of modern healthcare's 100 most influential people in healthcare for 2014, and joins a prestigious list of notables, as you'll probably know who this person is, U.S. President Barack Obama, numerous policy leaders, insurance executives, and healthcare executives throughout the country. He also recently was named one of the top 25 minority healthcare executives in the country and one of the top 50 most influential physician executive healthcare leaders. During his tenure in the healthcare field, Dr. Raju has had many accomplishments. While at HCC, the organization reached great heights in the quality and patient safety standard arenas with a focus on health equity. His pioneering work in healthcare data transparency won the coveted Eisenberg Award. During that time, HC captured many awards, including the Pinnacle Award, Quest for Quality Award, and the Nicholas Davis Award. Behind the title in all of these awards, you'll find a very humble and passionate and purpose-driven leader, committed to making sure his organizations and others across the country provide each and every person who comes through their doors with high quality, safe, and equitable care. Through his leadership, his organization created a 2020 vision plan. I have that here right in my hand. If you could get your hands on this, it's an excellent blueprint for any organization endeavoring to ensure that equitable care is delivered to every person they serve, as well as increasing diversity in the workplace. So this plan is a roadmap to enhance equitable care that builds on their strengths to increase workforce diversity at all levels, including board of trustees, and build sustainable organization and communities that they serve, and improve the patient experience and outcome. I'm honored to work alongside Dr. Raju and recognize such a deserving healthcare leader. Dr. Raju is a member of the AHA Board of Trustees and chair of the AHA's Equity of Care Committee, where he leads the association's, and you may have heard of this, and if not, I invite you to participate in the hashtag 123 for Equity Pledge to Act campaign to eliminate healthcare disparities. My friends and colleagues, it is an honor and privilege to present the Booker T. Washington Award to Dr. Ram Raju for his efforts to advance diversity in the healthcare field, reduce healthcare disparities, and for his unwavering commitment to provide equitable care to all persons. Please join me in welcoming Dr. Raju to the stage here.
Thank you, Tomás, and thank you, Dr. Puckrein and Congresswoman Kelly, whom I go back a long way in Chicago, Cook County, and Dr. Harris, thank you for being here. You know, my journey of disparity healthcare started 14 years ago, because as you probably would have imagined or known, right, I was trained as a doctor back in India. And if you ask any developing country doctor, medical school, what do you want to be? They will all tell you, I want to go to America, because that is the best healthcare system in the world. That is where you get the best education you can ever get. And I was one of them. I felt this is the best country to be there. And for the first 20 years of my life, I thought we had the best healthcare delivery system in this country, because I practiced surgery in Brooklyn. You know, I took care of everybody, turned no one away. And I always felt that everybody in this country got the best health care because I was available to my patients, and I took everyone away. But that has changed. Then I realized that in this country, in our country, the richest and the powerful, economically very progressive country, and the most compassionate country in the world, whether there is a tsunami in Southeast Asia, or earthquake in Haiti, or AIDS in Africa, or Ebola in West Africa, Americans always step up. They give money, they give resources, they do that. But in this country, there are people who cannot get the care they want. And even if they get the care, the outcomes are not any better. The disparities in healthcare was staggering. So I am of the firm belief that of the IOM, Institute of Medicine talked about the 6 aims, equity is one of them, and quality is one of them. We advanced the quality in this country to great levels, where the equity suffered behind. Because I am of the mind, and I said this in multiple forums, there is no quality in healthcare unless there is equality. You cannot measure quality without measuring equality at the same time. And that equity of care, to take care of the disparities in healthcare, became a war cry for me for the last 14 years. And this is only began. There is a tremendous amount of need to be done. And I'm really privileged and honored to receive this award. You know, the transformational person who really fight for social justice, and that person's award is something very meaningful to me and my organization. And I really want to accept it on behalf of thousands of healthcare workers across the country who are trying very hard every day to make sure there is equity of care so that the disparities in healthcare will be eliminated and we will embrace diversity in work care. Diversity in healthcare is something which is important. So thank you for this opportunity. I am really humbled and honored to get this today. And I really want to thank the organizers for choosing me and my organization. But it will only give me more impetus to do what is right. There is no quality in healthcare without equality. Thank you.
So we're ready to go to work now. So we've got the CME across the way, and the plenary sessions will start immediately. So the next panel, if they'll come up. And thank you so much.